when you've traveled for your nursing stuff before, I can't remember what it's called right now. It's like left my mind. Where like, people like go overseas and, if they're having like natural disasters and they have people come in. What?
Yeah, like aid work and NGO nursing.
Yeah. I heard that people like that are starting to come to the U.S. because the cases are so high. Have they come to your area?
So when I got here in July, Doctors Without Borders, which is like the most prestigious medical NGO in the world, and they were here on the ground in July, which they've never deployed to within the United States before this. They were here on the ground. I came here with COVID Care Force, which is an NGO, and they still have a very big presence on the ground. I'm just employed with IHS. Project Hope is another NGO that I have deployed to hurricanes with before. They have a presence on the ground. So yeah, there is definitely a big aid presence on the ground, which I think is just mind-boggling to me that I'm in America seeing the problems that I'm seeing and dealing with aid and I'm working side by side at aid organizations. The last time that I worked side by side with Doctors Without Borders was in a refugee camp in Greece, and now I'm doing it in rural Arizona. And last time I worked with Project Hope was in a hurricane disaster response, and now I'm doing it here. And I think it's just insane to me that this is really happening in America.
Oh, obviously this is got to take a toll on you. Like, how have you managed to kind of like keep your mental health kind of like in check? Like, how have you been coping with that?
Honestly, I haven't been coping very well. I was in a point of just like go, like numb, just like you're kind of in almost disaster mode, and you're just like, I have to do this, you're just running on adrenaline. But I mean, after 6 months, the adrenaline kind of wears off, and you just get tired of seeing death and suffering. And especially, I think it's especially hard to deal with when you know that there's so many things that could be done to prevent all that you're seeing, and it's not happening. I think that's especially hard to deal with. And it's really hard to deal with, like, the hardest part for me has been just watching the country's indifference towards each other and people's indifference towards each other. So I haven't been coping super well. There is an NGO called Emotional PPE, which is offering free mental health services to healthcare providers on the front line. So I have been talking to a mental health provider through them. That has been helpful. But I think everyone here is really struggling. I mean, because you're just constantly dealing with death and suffering and loss. And it is almost like a feeling of helplessness because there's nothing you can do. And it's one thing because I'm feeling this and experiencing this, but also the Navajo nurses, because it's their community and their loved ones, so they're experiencing it on both ends of the spectrum. So it's a really sad situation all around.
How's your family feeling about you being in the position that you're at right now?
It's been really hard on my mom and my family because they worry about me being out here. It's been a really hard year on my mom because I've spent most of it in COVID, and then my mom actually had it, so I had to deal with it then, and then I lost 2 family members to COVID. So I mean, yeah, it's impacted me on a personal level, and then to come to work and help people mourn through the phone while they deal with their parents dying or loved ones dying. COVID's just a really awful thing.
Since it now affects you, like, hopefully I'm not stepping on to your toes or anything, but since now it's like impacted you even more in a personal way, since it's impacted your family members, if you see people not taking it seriously, do you get like kind of anger feelings towards others about it?
Yeah, and I did before I lost my family members, but especially now, because like I said, I think that's the hardest part about all this death and suffering is just knowing how much of it could be prevented. And it's so simple, but it's mind-boggling to me, and it's like beating my head against a wall. Yeah, it's very frustrating to me, and I think that contributes a lot to the mental health toll that it takes, is not just the the sadness that you see, but the anger and the frustration and not being able to do anything with that, yeah, that definitely takes a toll.
Mm. How about the other nurses? How have they been dealing with it? Have everybody been in the same kind of boat as you?
Yeah, I think everyone has been in the same boat, except you also, like I said, even though my family has had it, it hasn't ravaged my community like it has theirs. And so I think it's extra hard on them. And yeah, and I think this will have a really lasting impact on this community for, years and probably a generation to come. And it's not at all uncommon for them to call a patient and do an investigation and do all that, and then they discover like, oh, this is my cousin, or this is my cousin's girlfriend, like whatever. So I can kind of put up a mental block, and they really can't do that. So I'm sure it's really hard for them.